My name is Angela Duran, and I am the Executive Director of Excel by 8, which is a statewide organization that focuses on both building local capacity and impacting policy change. We are very excited in Arkansas that the Division of Child Care and Early Childhood Education at the Department of Human Services wants to take the EDI statewide. They have identified a local research institution, which is the Arkansas Research Center at the University of Central Arkansas, to lead the charge on taking it statewide. Arkansas used to have a kindergarten readiness assessment that did provide a pretty good look back on where we were, how prepared students were for kindergarten. We don't have that anymore. And so we need something that helps communities have a data point that says, where do we need to invest? And so communities being able to have the EDI and see what the needs are, can figure out how best to invest. Having data can help those resources be invested in the best way. We have this grid of resources that we really use to talk about our work. And we really look at it as terms of an electric grid. And so there are all these boxes related to families, communities, health, and education. And as the communities began their planning processes, we came up with data points for each of the boxes on their grids. And so they would see data points related to each of those, but the EDI has really helped them to dig deeper and to begin to see what maybe some of the root causes are behind some of the outcomes. So it's been a really beneficial data point for fleshing out what they may see at a high level. I want to pull an example from one of our communities, which is Independence County. One of the things that jumped out as the community started looking at the data was around physical health and well-being. And what they found, particularly when they dug into the subdomains, is that there really wasn't much difference overall. But when they dug into the subdomains, they realized that there were some issues about both gross motor skills and fine motor skills. And what was interesting to them is that it really didn't differ by census tracts all that much. It was a challenge that was countywide. Now it's like all the early childhood education leaders in the community are aware that this is a community-wide problem, and they're looking at some particular things. And so one thing they've looked at is the CDC's developmental milestone tracker, and they're trying to figure out how they could promote that to parents so the parents could see where their child should be at 6 months, 12 months, 18 months, and then get help for them if they're not where they need to be in terms of gross and fine motor skills. They also realized that they had a big gap in terms of infant and toddler care in their community, and that was a place where some of these skills could begin to be developed. And so they are now investing in developing a new child care center that's going to offer 100 infant and toddler slots, which is a big way to fill a gap in their community. And then finally, there was someone from the local community college who's now thinking, okay, if this is an issue, what do we need to be making sure that we're teaching the students in our early childhood degree programs? At Excel by 8, we have a vision that all children will have access to quality health care and education that maximizes their full potential, regardless of where they live, what their gender is, what their race or ethnicity is, whether they have a disability or not. We want every child to reach their full potential. And the EDI really helps us figure out where in our state children aren't doing so we as a state and communities around the state can make the investments we need.